A simple test can find signs of heart disease in people who may not know they have a problem. The coronary calcium test can allow doctors to act before heart disease gets out of hand. Joining us on today's Heart of the Matter to explain is Dr. William Russo of the Stern Cardiovascular Foundation. And thanks for joining us, Dr. Russo.
Thank you, Joe. Glad to be here.
What is a coronary calcium scan?
It's a X-ray type of test done by a CAT scanner. It produces a number that tells how much calcium is in the coronary arteries. The patient will lie down on a table and will be moved back into a big donut type machine. It's not claustrophobic type of donut. And the scan is run, and the machine figures out how much calcium is in the arteries and gives us a number, anywhere from 0 above 400, depending on the severity of the calcium.
Why does the presence of calcium mean there could be problems?
Usually calcium is associated with plaque in most cases, although there are patients who have calcium on the outside of their arteries, and inside the artery where the plaque is, there is none. And that's not the rule, though, but if you have calcium on the coronary score, the calcium score, you're going to have some plaque. It depends, though. Some people have more than others. The numbers don't really jive with the amount of calcium in some cases.
What does it mean when a patient has a high calcium score?
Well, first of all, any calcium is abnormal. Now, high calcium score is usually above 400. That's when we really perk our ears up and get very interested in the patient. That means there's a high probability of plaque, significant plaque, greater than 50% in at least one coronary artery.
If the score is low, does that mean everything's okay?
It usually does, but I have seen several patients who had 0 in one artery and high score in another artery, and we did a heart catheterization, and the artery that had the high score was normal, and the artery that had no score, or 0, had plaque in it. So it's not 100% predictable.
What are the criteria for determining who should get a coronary calcium scan?
Well, first of all, those who have established coronary disease should not have the scan, because we know what they have already. Why waste the time? And there's radiation involved, and more radiation exposure, the greater risk of cancer. So those who should have the test are those folks who have high risk factor levels, risk factors such as smoking, hypertension, diabetes, positive family history, obesity, and those people really need a calcium score if they're not having any symptoms. Those who are having symptoms, though, chest pain, angina they call it, could have a calcium score done, but not necessarily. They could go through a stress test, which is very effective and very sensitive in telling if there is blockage. First of all, you have to have about 60 or 70% blockage or more to show an abnormality on a stress test.
What's the course of action if a person has a high calcium score?
It depends. If someone comes in and they're not having any symptoms whatsoever, but they have risk factors and they have a high calcium score, we will provoke them on the treadmill. We'll try to find out if they do have symptoms or have any ischemia, which is lack of blood flow, which is diagnosed by the stress test itself. And we do the regular or the thallium treadmill nuclear stress test. It's very sensitive in telling if there is a blockage in one or more of the arteries.
If there is a blockage, what then?
We discuss this with the patient and the family and say, Mr. Jones, you have this test that shows that you look like you have at least one blockage or more, and we show them the calcium score, and then we say the next step would be a cardiac catheterization. And this would have to be done in the outpatient cardiac cath lab or in the hospital, and that way we can tell exactly where the blockages are, how bad they are, and what needs to be done. And what needs to be done is the next step. If there's only mild blockage or no blockage, sometimes we find a false positive stress test. But if there are blockages of 70% or more, at that time we do a stent or a balloon angioplasty where we dilate the artery and put a little wire mesh in the artery to keep it open. Now, if there are more than 3 vessels or 2 or more vessels involved here, and if they're diabetic, it seems like bypass surgery is the best bet for this patient.
Dr. William Russo, thank you for joining us today on Smart Medicine.
Thank you very much.